Welcome to the Sandwich Generation Survival Guide. I am your host, Candace Dellacona, and I am thrilled to have with us today Denise Scruggs. Denise is the Director of Education at the National Council of Certified Dementia, and she was kind enough to spend some time with me today, and we're going to talk about the best ways to effectively communicate with our loved ones who have dementia. So welcome, Denise.
Thank you. It's great to be here with you today.
I'm so happy to have you here. I think you have so much knowledge on this topic, and so many of our listeners are going to have so many questions that you're going to answer and in the best ways to really get the message across, if you will, to our loved ones with memory impairment. So why don't we start at the top? And we'll talk about the basic human need for communication and why, as humans, we need to communicate.
Sure. Well, first of all, we know that being able to communicate or socialize with somebody else, that's as important as exercising and eating healthily because we need it for our mental health. And it is also good for our cognitive health, because we work our brains anytime we're talking with somebody or interacting with somebody. So what a great way that we can interact with our loved ones and keep them at a higher level of ability just by engaging them in a conversation. Or even if they can't engage in a conversation verbally with us, that they're indicating that they're following with us or they're looking at pictures with us and they're actually engaged with us. That to me is exciting to see. But we also know too that if we don't engage with somebody, we fail to thrive.
Yes.
It's sort of like the child that's born early and in the incubator, and we have people that are volunteers coming in and sitting with them and talking with them and touching them. You know, it doesn't change for us as we get older either. Yeah. We have to make those connections. If not, we get lonely, we feel isolated, and we can even get depressed.
I can see that. I mean, spending a day or two alone, sometimes you start to get lost in your own thoughts. So I'm with you on that, Denise.
Oh, definitely. You know, COVID really, really hurt people who had dementia or who people were alone, because that made the dementia progress more quickly because people didn't have someone to talk with or to interact with as much. And that's one of the again, shows us how important that communication with other people would be for all of us.
Yeah, it's part of who we are. And so, you know, the troubling part is that as our loved ones progress in their disease of memory impairment, whether it be Alzheimer's or Lewy body dementia or dementia, any number of memory impairment issues, it interferes with their ability to communicate with their loved ones. So let's talk about that.
Well, and one thing that we know is it changes how the person with dementia communicates.
Yeah.
Whereas we're having this conversation and we can chat and we can have a really deep conversation, where the person with dementia, it changes totally.
Yeah.
You know, it might be less words, more nonverbal communication, but particularly dementia affects how we concentrate, our ability to focus. It affects our memory. It might cause more confusion. We might even hallucinate if we have dementia. And that affects a lot of how we respond. For example, we might not be able to complete our sentences. We might not be able to find words. And I'll give a real example. And I've mentioned to several people, you know, I had a brain aneurysm myself. So I have what would be called mild cognitive impairment, which is the first step before you might actually have Alzheimer's, where you have trouble finding words and so on. But what happens with a person in actual dementia, it's a lot more difficult.
Right.
They become quieter. They have less to hear and understand what we're saying gets more difficult, and to be able to respond back becomes more difficult also. For example, they might be cold and they start shivering, and you're looking at them and you're thinking, well, they're cold, but they tell you how hot they are, because too, they might have difficulty finding the word. We can look at them and say, there's goosebumps on their arm. That's probably not hot. And we touch their skin and it's cold. So we know that they use the wrong word. As a caregiver, we have to kind of look at that and say, what are they saying? And not only look at what their words are saying, but what is their body showing us?
Yes.
What are their nonverbal showing us? So we start learning to communicate with that. Another thing that we know is it might take longer to process information. So what we have to do when somebody says something to us, it has to go into our brain and we have to figure out what they said, and then we respond back or we do what somebody requested.
Yep.
Now, we do it fairly quickly ourselves. Person with dementia has a whole lot longer time and to hear what we've said, process what we've said, and then to make a response to that.
Yeah.
It can take up to a minute or longer for them to do it. And what makes that difficult is because they have such a delay in answering, sometimes we might walk away, we might repeat the question, we might ask other questions. And what we don't realize we've done is we've disrespected them, or we've said your answers don't matter, or we frustrated them and they kind of get mad and say, I just never mind, don't listen, I don't care.
Right.
And they just walk away from us because they're just shut down. And what we don't realize is we created that.
Yes.
Because we kept asking questions.
Yeah. And conflating whatever it is they're trying to process. I mean, it's interesting. I had a conversation once with a physician, a neurologist, and he said, have you ever been in a loud restaurant and you cannot decipher all of the conversations around you? That oftentimes is what a lot of people with dementia are going through. They're trying to pull apart the words, recall the words, and really hear what the question is. And so the patience, I think, I mean, if that could be a theme, obviously, for caregiving, I think patience is pretty universal, isn't it, Denise?
Oh, definitely.
Yeah.
Definitely. And kind of going with the flow to go with that.
Yeah. Yeah. And
because,
slowing down. Yeah.
Yeah. Just slowing down and learning to go with the flow with that too. And knowing, again, that there's going to be delays and that they're not doing it deliberately.
Yeah. Oh, good point.
They're not doing it deliberately. This is all the dementia. When my mom had her issues with dementia, I had a mother and a grandmother with dementia. Right. And mom could, it would be so frustrating sometimes. I'd have to leave and I would find myself reminding myself over and over, it's not my mom, it's the dementia. Yeah. It's not my mom, it's the dementia. It's not my mom talking to me like that. It's the dementia.
Right.
Creating that situation. And it was a good reminder for me to know sometimes when I got frustrated, especially when we had to take her to a doctor or something had to happen. And then she had a different idea of what was going on. All those things added to that. So patience, well, they say patience is a virtue. It really is when we're caregivers.
Absolutely true. I mean, and that sort of leads us into the conversation about a dementia patient's sort of grasp on reality, if you will. And you kind of mentioned it at the top, right? Where one of the things that dementia causes is significant confusion, depending on how far in one is to their diagnosis, and hallucinations. And so I know a lot of our listeners struggle with mom or dad saying, it's Tuesday, or I want to go home, and they are home. Or, you gave a great example of saying that the sky is pink, but it's blue. Yeah. So what is your advice to the loved ones who are perhaps correcting or, responding in this situation? What's the best way to handle that, Denise?
Well, sure. And I think the best way is to go with the flow. We go to where they are. We're not going to convince them. If they look out the window and they tell us what a beautiful pink sky, they're not going to believe us when we say it's not pink, it's blue. They're just going to get mad, because why are you lying? Why are you saying that to me? In their world, they see pink. Yeah. We're never going to make them see blue. Yeah. And when my grandmother had dementia back in the 70s, that was what we did. We called that reality orientation. And we were told that you need to bring them into the real thing. If it was Friday, you argue with them if they thought it was Saturday to help them realize it's Friday. Well, all that did was create anxiety and fears and stress. Nobody had a good day when we did that. Nobody had a good day.
What was that called, Denise? What
it was the reality orientation is what we used to call it.
Got it.
And we had to bring them into what the real world is.
Got it.
And now the thought is, we don't do that. We don't have to do that. Does it matter if it's Monday or Friday to them? No, it doesn't. Yeah. Does it matter if the sky is pink or blue? No, it doesn't. So we have to learn to be flexible and kind of go with the flow. And, so if they say it's a pink sky, I might say, yes, it's a beautiful sky. If I didn't want to go totally and use what we call now therapeutic lying and say, yes, it's a beautiful pink sky, knowing that it's not, that's therapeutic lying. When I go where they are and I say, yes, it is, and I know that's not reality. But sometimes we do that, and that's okay. And if we don't feel that we can do it to that way, we just say, yes, that's a beautiful sky.
Yeah.
So,
So therapeutic lying. So when, I have had a lot of adult children sandwich generation members who are, feeling badly when they say, well, the house was sold and mom keeps saying that she wants to go home. The answer really is what is kind, and that therapeutic lying, is maybe the answer for people to make them feel better, because I get why they don't want to misrepresent anything to their parent, but at the same time, if it just causes an anxiety and stress, as you point out, there is no point, right?
no. And I always say it's a need to know.
Yeah, need to know.
Do they need to know their house was sold if we know they're never going back?
Absolutely right.
Do we need to say that you're going to be here forever? Maybe they're not. Maybe
Yeah.
we'll take them home again. Well, they're here now, and you don't need to worry. You're here today, and we want you to stay here for a little while. And we don't have to say you're never going home,
Yeah.
right?
Yeah.
But we live in the moment at that point. We don't have to create that angst. I'll give you a real story. We had a situation where a gentleman's wife passed away, and the family wanted him to know his wife passed away. He was in about early to middle stage dementia. And what happened was he just got more angry and angry. And, if we've ever heard that said to us, that we've lost a loved one, it hurts. It creates a lot of emotion and a lot of the feelings. Well, he felt those feelings, but he kept forgetting that his wife passed away. So he kept going over those feelings again and again. Within days, he became angry. Within more days, he became violent. And within even more days, he thought about suicide. He had periods of clarity. He was thinking about committing suicide to be with his wife.
Right.
And all because they wanted him to know that his wife had passed away.
Right. So he was hearing it for the first time every time.
And can you imagine 30 times getting that information in a day and those feelings building up? And you don't understand. You still have those feelings, even though you don't remember why you feel it.
Absolutely.
That's why we don't. That's why we have to be careful. Do it. Some things we don't say, and something like that we may want not to say.
Yeah.
To be kind, like you said.
And so that is a really great example of a big life event that one would think you should inform the person. But to your point, to what end? Need to know. I love that sort of mantra. And I think a lot of our listeners too struggle not only with the alternate reality maybe of their loved one with dementia, but the repetition, right? And the short-term memory issues. So, what's your best advice when a question is asked repeatedly in a lot of different ways, or maybe in exactly the same way? How do you handle that best, Denise?
Sure. Well, first of all, they're asking it because they're having short-term memory problems.
Right.
So they forget that they've done it. And we do it verbally, or we might do it because we come to dinner 5 times and we tell you I'm here for dinner. What it is, I forgot I already ate 4 times, or I already ate and sit down at the table. So you're not going to convince me. So you may have to give me crackers one time. You may have to give me a dessert later. You might have to feed me 5 times because you're not going to convince me I've already been at the table.
Sure.
If I think I need to eat. So what we usually would say when somebody's repetitive, sometimes there's little things that we can do, but mainly we want to act as if it's the first time they've said it.
Okay.
So we respond as if we've never heard that question. We don't say we've already told you 10 times that it's 2:00 in the afternoon.
Yeah.
We don't say that. Instead, we act like we've never heard it, and we tell them it's 2:00 in the afternoon. The other thought that we have with repetitive verbalizations, that's what we would call that,
Okay.
is that we would think of other things they can do with their mouth. So maybe we give them their favorite snack. So now I'm eating, I might not keep asking you that question. Or maybe if I'm humming or singing or whistling, I'm not going to keep asking you the same question. So thinking other things they can do with their mouth instead of asking that same question. So sometimes it's just a change of scenery.
Yeah.
I get up with my loved one from the sofa, and I go over to the dining room, and we walk over and we get a snack, and then we redirect in a different way. We talk about something else, or we start singing their favorite song, or we put music on. And that may stop those repetitive questions.
That is a great tip. I mean, caregiving is hard enough. And, I understand why the repetition can sometimes be hard to take, especially if it's gone on for quite some time. But what a great tip that the distraction and using the mouth in a different way. I mean, I think that's terrific. So, I mean, in terms of, the other sort of barriers and hurdles with communication. And as caregivers, we, we're all guilty of this, right? Where we sometimes make assumptions about what our loved ones can do, can't do. We're trying to protect them. We don't want them to get hurt or, feel bad. So, do you have any tips, Denise, about those things that our listeners can do for their loved ones?
Sure, sure. Well, like you said, one thing that we have to be careful of is not to become, if we put, buy into stereotypes about dementia.
Yeah.
For example, if we think they don't know, we may not talk with them as much. Or we may not give them opportunities that they still could do because we think they don't know or they can't do. So we're not giving them opportunities. I'm not going to try to talk with them because I assume they can't. I've seen people that are very quiet, hold their head down, not talking to many people. And when we put music on, they're singing every verse of a song. They're able to articulate after you put the music on. They're talking with other people, but they've just been in that mode where they've just been really silent.
Yeah.
So not making those assumptions, because again, that can get in the way of what we do. But we do get protective, right? We love them. We want to take care of them. We want to put them on the couch. We're going to take care of you now. I'm going to take care of the house. I'm going to take care of all the bills. I'm going to take care of everything you need. And you just sit there and enjoy life. But what we don't realize is we're taking away their lives.
Yeah.
We're making the dementia go faster, progress faster, because we're not letting them be involved in life. And there's two ways I say we leave this world. We live to the end. We sit on the couch and we mark the days off till it's over. And our goal for a person with dementia, as well as ourselves, right? We want to live to the end, to that last moment we get the most out of it. And people with dementia can still do that. They can still do that if we give them the opportunity. So even though they're not talking with us as much, they could still laugh and giggle and so on with us. And I'll just share the one example that I think I've mentioned before when you and I have spoken. I had a person that I went in with a bad haircut one day, and it was obvious I had a very bad haircut. I was about 2 inches longer on one side, and I asked my husband the night before, do I look okay? Well, of course he said, yeah. Well, I could look in the mirror. He couldn't have won, right? I was mad that he said I looked okay and I knew I didn't.
Exactly.
And if he just said I looked bad, I'd been mad there. Well, what did I do? I was running a memory care community at the time. I walk in and there's one of my residents of middle stage dementia, never said much verbally. Well, when I walk in, she tilts her head to the left. She tilts her head to the right, like something's wrong here. So I pat my head and I said, I had a bad haircut. She shakes her head violently, yes. I said, my husband said, it looks good. She shakes her head violently, no, it doesn't look good. And then I laughed. I said, well, he'd have been in the doghouse every way. And she just started giggling like a child. And we started laughing. I said, even couldn't get out the doghouse. So we did that probably 20 times that day, that same conversation, because she forgot she asked it. Right. The next day, we went through it again about another 10 to 20 times. She started taking her fingers and putting them like scissors in front of my hair, saying, you need a haircut. Yeah. So I'd look at her. I said, I need a haircut, don't I? And she kept putting her scissors up in my head. I said, yeah, I need that haircut. So when I came in the third day with the haircut, she approaches me. Her head goes a little to the left and right because we'd really, we'd been connected 40 times at least in 2 days. So she knew something was different, but she couldn't figure it. So I tapped myself on the head. I said, I had a haircut. Do you think it looks okay? And how many times do we ask our loved ones their opinion? They still have opinions, true. Right?
True.
So, they may not say it as much. They may not come out as much words, but I can say, do you like it? And so I said, I had a haircut. And I said, do you like it? She nods her head yes and gave me a kiss on the cheek. So did we communicate?
Absolutely, you did.
Did we connect?
Yeah, absolutely. You had joy because there was laughter. There was a connection over the shared experience of having a spouse rubber stamping bad haircuts, I'm sure.
Yeah.
But that is an amazing anecdote, right? Because in that little sort of retelling, you sort of demonstrated how the communication may not have been what it was 10 years ago, but it's different, but it's still there.
Definitely. And they don't lose the ability to communicate. It just takes different forms.
Got it. I love, now, taking different forms.
Forms.
Yeah. So
and that's just one example. Yeah.
Yeah. And so looking to those cues to really understand maybe what they're thinking or feeling and acknowledging those cues. And, one of the things that you said to me, which I thought was so important, and we're so focused when people have dementia, their progression from a neurological perspective, right? And one of the things that you share with families is you need to keep up on other things too with respect to the person who has dementia, their vision and their hearing, because those two senses greatly impact the person's ability to communicate. So can we talk about that a little bit?
Oh, definitely, definitely. And, even the newest research says if we don't work with hearing, or a person with or without dementia, that they're at a higher risk of dementia. Dementia can progress more quickly.
Just because the hearing is
the hearing.
Interesting. Wow.
It's kind of like being alone in a room when you can't hear. You could be around 20 people, and it's like you're sitting in a room by yourself all day and around, and you're not connecting with anybody. Right. So it really has a profound impact on your cognition. So, I'll give you a real life example. We can make assumptions based on somebody's not being able to hear us. I did a program in a memory care community one time, and my husband went with me and helped me set up. And he went to leave, and he has profound hearing issues, and he refuses to do something about him. He's very vain about that. I'm not going to do it. I don't need to do it. But anyway, they wouldn't let him out of the memory care because they were talking with him. He couldn't understand the questions, and he was answering the questions incorrectly. So they did the right thing, and they asked him, where do you want to go? And tell us what you want to do, and different things like that before they brought him back into me. And I could say, that's my husband, before he left the facility. And that was somebody who has no dementia, but because he had the hearing issues, he could not communicate. Right. Now, you have the similar thing happen for a person who has dementia and still cannot hear, too. That makes that communication even harder.
Absolutely. I mean, being able to hear what's going on, even if it takes you longer to process, is the first step, isn't it?
That's right. And then vision, too. A person often hallucinates because they can't make out what's around them. I look at a coat rack and I think it's a man standing over there looking at me.
Yeah, true.
And we've actually had that a number of times where they see a ficus tree or tree in the corner, a coat rack or something tall, and they think it's a person because they're trying to make out what that tall thing is over there, and they can't figure out what it is, or they can't make sense of it. Or they hear voices in the TV that they can't see, and they think somebody's coming to get them because they've heard the news.
Yeah, and they can't see it. Yeah.
That's why we always say, with the news, too, is something that we have to be careful. As a person gets going through dementia, you have to be careful not to share the news because they can't separate that from reality. My grandmother, for example, before we knew not to do that, would after she would see something about a war, she would say there were men out coming after her, that there were people standing at the window to kill her, and so on, because she also didn't recognize her own face. So when she looked at the mirror, back then we didn't know that either, she would look at the mirror and think people were watching her.
Oh, my goodness.
She'd think they were coming at her. Or she'd look out the window, and when it would be dark outside and light inside, she'd see a reflection and think people were after her.
So really not being able to distinguish, for example, you bring up a war in Ukraine and someone could think that there's a war here because they're not able to process it in the same way we are. Distance, time, all of those things. That's a really good point.
Or hearing somebody yell or scream or something on TV, they're just trying to make sense of the world around them. And when we have dementia, it's difficult. So we can say, oh, yeah, that's just a TV. They don't have that ability to differentiate what's going on. Absolutely. And that's what makes it scary.
Yeah, for sure. And that's the last thing as loved ones we want, right? We want to make everything comfortable and calm for them. And, one of the examples that you brought up too is how important it is that when you look for visual cues, they may share certain feelings with you because they can't communicate, or you see something in them like getting angry for some reason.
Yeah. And, I love what Barney Fife used to say, and Andy Griffith. And this is showing my age here because we used to watch it when I grew up. But Barney Fife used to say, nip it in the bud. So the whole thing, and I use that all the time because for us working with our loved ones, or us working in a community as a professional, the more we can notice when somebody's not their normal self, we call it their baseline, then they're not their normal self, then we need to ask why. Right. So we're looking at it. Are they showing more happiness? Are they showing more anxiety? We look at their hands. We look at their mouth. We look at their eye contact. We look at their body language. We listen to the words and the sounds that they use. We look at how they move their body. This is all telling us something. We just have to learn to read it. And then we also have to learn how to use our body positively so that we're creating a positive message and creating a positive relationship. And there's ways we can do that too.
And keeping the calm for them. And I guess in some ways they're probably watching your cues too, if that's what they sort of understand. So I guess being very cognizant of those things too. I mean, it makes sense, right? Where, if you are not able to communicate with someone, in your everyday, you feel frustrated, you could get angry, especially if you're hungry and you can't talk about being hungry, right?
Oh, definitely. And we go back to our natural instincts that since we were ever in humans, that it's fight, flight, or freeze. So I'm either going to run, I'm going to freeze, or I'm going to fight if something scares me. And that's where they're just operating and trying to figure out, are you safe? Are you somebody I'm okay with? Is this environment okay to be with or not? And I'm going to do one of those three things.
Yeah.
Or I might feel comfortable and then I'm okay with the environment. So that's the fourth thing.
Yeah. Amazing. I mean, I think what our listeners would probably want, and you've given such great advice so far, is what are your sort of real world suggestions or tricks of the trade for getting our loved ones with memory impairment to help us communicate? What are the best tips you have, Denise?
Sure. Well, first of all, as much as we can smile, where they used to say smile and the world smiles with you.
Yes.
And that's true, right? It shows we're friendly. We're not in a bad mood. We're safe, and it makes a person feel comfortable. And so approaching with a smile. And sometimes we might have to take 5 seconds or 5 minutes and we need to step aside and deep breathe and all before we go back because our nerves are just so shot because of how the day has gone.
Sure.
And we've been there many times.
Yeah.
And before we come back. But the other thing too is that we want to make sure that they see us and they know we're there before we start talking.
Okay.
Because if we go in and just start talking, they may not have caught us at the beginning. And now they're in the middle of a sentence and they're having a hard time understanding what we mean. So when we go in and we're saying good morning or we're seeing our loved one, smiling them, love you, and getting on their eye level so they don't feel nervous. If they're sitting, we sit. If they're standing, we can stand, or we kneel in front of them if they're in a wheelchair. We know that's important because that creates a level of comfort and creating a good environment. If there's the TV on and people talking and phones are ringing, it's hard to focus on what you're saying. And it can get a little overwhelming and I might just blow up because I'm just overwhelmed by all this.
Absolutely.
My grandmother, for example, had that happen in a long-term care community and threw her dentures at somebody because there's too many people and too much going on. She created a scene in a long-term care community by throwing her dentures at somebody. And by the time they came in there, 4 people had their dentures out there. And she got kicked out of the long-term care community back in the 70s because of it. Oh. But what it was, she was not used to all that noise and all those people and all that stuff going on. And we never thought about that. And we have to consider what our loved ones used to.
Yeah.
Are they used to being around people? Are they not used to being around people? And again, creating that optimal quiet environment, watching what's going on in the background so it's not too cluttered, not too many people talking,
right.
So they're not so distracted. And even having good lighting so they can see us.
They can see your visual. Yeah. I mean, when you went back and we talked about taking a breath and allowing them to process what you're saying. So, being sort of calm and getting down to their eye level and giving them an opportunity to respond to us before maybe we jump back in is such great advice. In the calm environment, going back to the background noise, I'm going to be 50 and I can barely decipher words in a large setting. So I can't imagine how it would be to have dementia on top of that and maybe not be so great hearing as well.
Oh, definitely. And keeping in mind, again, they're just trying to make sense of stuff and it's overwhelming. They're trying to focus. And when we can't, like you mentioned, that example being in the restaurant, that they have less ability to focus.
Sure.
In that restaurant than we would. And we have difficulty with it. And it's remembering that, with them. And again, paying a close attention to what they're saying, or again, what their body language is, using simple words. One person once said that people get diarrhea of the mouth. And we just keep talking, or we use a lot of long words. For the person that we love, it might be just go in and say, "Mom, I love you."
Yeah.
"Mom, it's breakfast time."
Right.
Not, "Do you want to come to breakfast?" I might go in and say, "Mom, it's breakfast time."
Sure.
And the fewer words make it easier to understand. So watching my conversation and keeping it as simple as possible, and sometimes using pictures. One of the things we did a lot of and have done a lot, and I did it with my grandmother especially, we knew she loved, say, Coca-Cola and orange juice, and she couldn't find the words. So we had a photo album, and we cut out pictures of orange juice and Coca-Colas, and we'd say, "Granny, do you want Coca-Cola or orange juice or water?" And we showed her the picture while we talked about and she could point to the picture what she liked.
What a great idea.
And it's thinking, how do we communicate with our eyes, with their ears, with their nose, with their mouth, and with their touch?
Yeah. And that's, that hails back to the advice that you just gave, saying there are still things that people with dementia can do, like choose whether or not they want Coca-Cola or orange juice. They may not be able to recall it without the picture, but giving them the picture allows them to still communicate. So you are empowering them.
Oh, definitely. And we can make it simple. And that's what we always did. With my grandmother, because she was later on in the dementia, but we could put 2 pictures or 3 pictures to the side, and she could pick usually between 2 to 3 things.
Wow.
And then we were able to do that. And that let her communicate longer what she wanted as much as possible by just pointing.
And validating their feelings. Yeah. And really validating and, the reassurance. And I know you have an example of making sure they feel validated.
Sure. So I want to give you just an example. If you went to Walmart and you couldn't find your child or the child that was with you, and you start getting anxious and you can't find Johnny, where's Johnny? I'm getting nervous. In my world, I can't find Johnny. Where's Johnny? I got to find him. And you come up to me and my name tag says Denise Scruggs, Walmart manager. And you come up and say, "Denise, I need your help. I can't find Johnny. I've got to find Johnny. I don't know what's going to happen. I got to find Johnny." And if I put my arm around you and said, "Come, let's go sit down and have a glass of tea."
Yeah.
How would you feel?
Yeah. Much better.
Yeah. But would you even feel that I validated you? Because I didn't say, "Tell me about Johnny. Let's go look for Johnny."
Well, definitely not. Yeah.
Yeah. Yeah. I just said, "Let's go have a cup of tea," and totally unheard what you said you were looking for Johnny. And sometimes we redirect somebody without reassuring them first.
Yeah. And just acknowledging what they've said and whatever their fear is, as opposed to, okay, I think the tea will comfort them, but if I'm not going to acknowledge what they are feeling, then they're not going to have it resolved in their own mind.
So yes, knowing you love tea, getting the tea that I know you love, that's good. And but I'm also going to say, "Tell me about Johnny." Or I may have to go into therapeutic lying. I may have to look for Johnny for you.
Yeah. Yeah.
I may have to say, "Oh, I forgot. Your husband said he picked up Johnny."
Yeah.
Or, you don't need to worry about picking him up. Now let's go have a cup of tea.
Right.
I may have to do those things to reassure you that he's okay.
Right.
Or even at that point, I might have to say, maybe I know Johnny's dead. So I don't tell her Johnny's dead. I might say, because that might be what caused the anxiety. Something triggered her thoughts about her son that she missed. And that's why she's all of a sudden feeling anxious and got to find him.
Yeah. Yeah.
So it's all those feelings going on there. So acknowledging you, "Tell me about Johnny."
Yeah.
Or I might even have to look for him again. And then I would give you a cup of tea. Well, let's go sit down. You don't need to worry. Everything's taken care of. Now let's go sit down. And then I try to redirect you to some positive thoughts.
Yeah.
Because we don't know what's actually going on in your mind about Johnny.
Yeah. Absolutely. So the order in which you comfort, acknowledging first, comforting second, and then using those positive words so that the person feels good.
Exactly. And some of the positive words, it's just remembering, the words we say can lift somebody up.
Yeah.
It can put somebody down. It can show we accept them or not. And I'll give you a real life example. And it's a really sad example. It really broke my heart. But my mom was in a hospital one time just before she passed with dementia. And somebody made a comment about how ugly her teeth were. She was in middle stage dementia. And I think they made it in front of her. Yeah, they had to. And we did find out they did say it in front of her. And they apologized. But what happened was, from that point on until the day she died, she would never open her mouth. She never smiled. She would hold her mouth unnaturally closed. and she very rarely talked. Up until that point, she was still talking with us. She would laugh with us, and she smiled. What they forgot was she's still there. She still had self-esteem. She knew that people said something about how she looked and that she looked bad, and it impacted her for the rest of her life.
Wow.
Until she died.
Right.
And, sometimes we forget they hear us. So the moral to that story is we have to be careful what we say in front of them. They're still there.
Yes.
They're still there. And we include them in our conversations. And if they would have said something to us, which we later worked with the staff on, is that we couldn't do anything because it would immediately kill her. We chose not to put her under anesthesia because they said she would never make it if she went under anesthesia. And we were doing other things for pain management. But that was a lesson for me because I never realized how much it was impacting or would impact her self-esteem in middle stage dementia. That was a real aha moment for me too.
Absolutely. I mean, so here you are, sort of one of the aficionados on communication, and you are also a daughter advocating for your loved one and really trying to step into her shoes and thinking about all of the people that are similar to your mom, your grandma. And likewise, I have the same examples in my own family. And, you've talked to me a lot about how important it is that we communicate in nonverbal ways too. Like you said, facial expression, getting down to their level and eye contact. And if it's somebody that you would always hug, try to hug them and show them affection in a way that they can process if it's comfortable for them.
Oh, definitely. And, we communicate without even knowing it. In our tone of voice that we use, go sit down, right? I'm communicating something, right? But if I say, come, Mom, let's go over here.
Right.
See the difference?
Absolutely.
Right. See how we would feel if somebody said that to me. I mean, whoa, what you talking about?
It causes anxiety. It's fear. It's uncomfortable. It feels confrontational. All the things.
Exactly. And we don't mean it, but we get frustrated for the day. So we have to really be in tune both with what we're saying and they're saying, our tone of voice, the pitch that we use, our facial expression, again, smiling, if our breathing.
Yeah.
We have de-escalated people being anxious and wanting and starting to get aggressive just by changing our breathing and breathing slowly with them and stepping back and not using words, but just giving them a little bit more space, getting less verbal and just calming down, even rocking in a rocking chair in that, but just doing other repetitive motions and stuff, but not saying anything, but just being there.
Yes.
So again, non-verbally, we can change how things are happening and what's going on without saying a word.
Right.
Pointing to something when we're giving them instructions, or we're trying to get them now, Mom, pick up that shirt. And then I might point to that shirt. That helps her know what we're talking about. Getting at our proximity, how close we are to somebody shows we care or not. If they're having a bad day, we don't want to get on top of them.
Yeah.
We step back a few steps.
Yeah.
And we, again, get quieter. We might just hold their hand, put our hand out, formed hold.
Yeah.
Yeah. It's like talking a lower tone.
Right.
That can calm somebody, just talking in a lower tone. When they get loud, we talk lower.
Right. In the same way, turning off the television, turning off all of the distractions and the noise. And, you use the example of the photos, which I thought was a great one for visually communicating and empowering your loved one. But the visual communication is super important with people with dementia.
Oh, definitely. And just things like signage. You've got a loved one that can still brush their teeth, but they forget how to do it. So maybe what you can do, instead of starting to try to brush their teeth, let them have that opportunity to do it themselves and empower them. Put a little sign out that says, brush your teeth, and put the toothpaste with the toothpaste on it. I mean, a toothbrush with the toothpaste on it on the countertop.
Yeah.
With a note that says, brush your teeth.
Yeah. Yeah.
We know too that we can empower somebody by putting labels on drawers, like putting an image of a sock and saying socks, image of underclothes and putting bras or underwear on it putting it on there. We can help people find their room by putting, even in the home, a sign on the bathroom door with a picture of a toilet so they can find the bathroom, or on their bedroom that shows their door.
Yeah.
We've even put their address on a door that they may not know that's my room door, but if they see their address, they know that's where I go. That's my address.
And so you're really extending their independence and finding different ways for them to continue independence differently maybe than in the past, but it's really kind of a loving gesture too, right? To try to figure out ways that empower your loved ones with dementia to feel that feeling of agency that we all want.
Oh, and that independence, that's, again, like you say, that's what we want. And I'll give you one last thought too, because, we get real frustrated sometimes when they're not drinking water. We
Right.
might put a glass of water or something in front of them. We'd say, now, Mom, be sure to drink that. Now, if we put in a cup they can't look through and see water or Coke or something that they don't recognize, they don't know maybe what to do with that. So we might need to put, please drink or take a drink on it. Because if I have a short-term memory, you put it and you walk away, I don't know what I'm supposed to do with that. I watch it all day and I don't know what that is unless I see a Coca-Cola signal on it or a Dr. Pepper signal. And I say, oh, that's my Dr. Pepper. I need to drink that.
Sure.
How do I know what's in it?
Yeah. Yeah.
So that's another way to use that visual communication.
Definitely. And I guess the last type of communication that you shared with us is the behavioral communication, right? And, when people with dementia lose the ability to use their words or successfully communicate their feelings, certain behaviors sort of follow suit because we're human and we need to express ourselves. So if you can't say it, you're going to act it out.
That's right. So if I can't say, help me, I need to go to the bathroom, I might, first of all, do it non-verbally. I might start wiggling in my chair.
Yeah.
I might start fiddling with my belt or my pants. And then if I still have to go and I don't know what I'm supposed to do, I can't get there, then I might start getting mad. I might start yelling.
Yeah.
I might start getting more aggressive or something with that because I'm frustrated. And number one, I have to go to the bathroom. And number two, I'm frustrated. I don't know what to do. Or if I'm sitting and I've already gone to the bathroom and been incontinent, then it doesn't feel comfortable, and that's even going to escalate it a lot more. Absolutely. So we have to remember behaviors are not somebody trying to do something against what we ask them to do. It's them trying to communicate what their need is. And that should be when we start seeing behaviors or emotions in their hands or their body, what are they trying to tell us? If we ask why,
Yeah.
that's the first thing we should do is ask why. Right. And I've heard if we keep asking why up to 5 times, we can usually figure out what somebody wants. Well, they're moving their hands. Why? Because they're restless. Why?
Right.
They're not comfortable. Why?
Right.
Or maybe they have to go to the bathroom. They're fiddling with their belt.
Yeah.
So if we keep asking ourselves why they might be, because we've learned to read every time he puts his fingers on his belt, that means, then we don't have to worry about that asking it 5 times, but that helps us figure it out.
So we have to look to the behavioral cues to really help them and reduce their stress and anxiety. And I think it all comes back to that, right? Reducing stress and anxiety and communicating in various ways, in different ways than perhaps they had communicated their whole lives, and adjusting our expectations. And I mean, Denise, this has been so enlightening to me, I'm sure to our listeners. And, do you have a couple of little gems that you can kind of leave us with in communication and all that you do? But I'll let you, Denise, kind of leave us with some wise parting words.
Sure. I just want to mainly say they're still there. Yeah. Even if they can't talk with us, they're still there. And we still should try to communicate. We can go on and carry on a conversation and have them never say a word, but they can still be with us by watching us.
Yeah.
We can communicate also through singing and talking with them, holding hands, patting somebody on the back. These are all ways that we can show that we love them and that we care about them. And we can give them the chance to do that too. And being patient, as you mentioned earlier, that's the key. And I just say sometimes we try plan A and we get it wrong. Well, we have to go to B or C. And sometimes we have to go all the way to D or F or Z because it might take us a few times till we figure it out. The good thing is once we figure it out, a lot of times it will repeat itself. And we know the next time we see something, that might help us know what to do the next time. But but it might be different. Sometimes they'll change. But most importantly, we want to use those opportunities to connect because we can create moments of joy. And where a person with dementia, we may not go on a week-long vacation and have a week full of every day, every moment that we enjoy. We might, with dementia, have a moment here and a moment there and a moment over here. Sure. And that has the same profound impact. Yes. Because absolutely. I may not remember that week vacation. I might remember this is this person that loves me and cares for me and is there for me, and I'm there for them. I may not remember they're my wife or husband or whatever, or my child, but I still remember there's somebody that they're my friend.
Yeah. And the moments of joy, I think that's so important, whether it's bringing your loved one a piece of chocolate cake, because that's what they love, and giving them something to smile about and looking for those moments of joy. I mean, life is hard enough, especially when, you're losing someone and their memory to a disease like dementia or Alzheimer's. Denise, I cannot thank you enough for your time today. You have provided us with so much information and so many great tips. And I just want to say thank you again from the bottom of my heart for this.
Well, thank you. Thank you for giving me the chance to come on with you today.
My pleasure. My pleasure.